If you brush this soft yellow dentin, you could do considerable damage without even realizing it. Welcome back to the channel. If you're new here, my name is Phil. I've been working as a dentist for over 12 years, and in this channel, I'd like to share with you what I've learned about dentistry and about dental health. I recently visited a pharmacy and counted over 60 different types of toothpaste. I can understand how some of you may be confused, and I wanted to help simplify things so you avoid picking the wrong toothpaste, which could potentially damage your teeth. For the sake of simplicity, I'm going to categorize the toothpaste into 3 different groups. Group number 1, high fluoride containing toothpaste. Group number 2, low abrasive sensitive toothpaste. And lastly, group number 3, which is regular abrasive toothpaste. You're probably thinking 3 groups is not enough considering all the different toothpastes that are out there, but hear me out, it'll make sense in a moment. Okay, so these high fluoride containing toothpaste are generally recommended for people at a high risk of getting cavities. This includes those that don't clean their teeth well, have a high sugar diet, have had a recent history of getting cavities, or if you suffer from chronic dry mouth, because saliva helps naturally prevent cavities. There are only 3 high fluoride toothpastes that I know of available here in Canada, and in no particular order. They're 3M Clinpro 5000, Colgate Prevident 5000, and Ctx4 5000. These are available over the counter here in Canada, but I believe in the States a prescription is required. Please keep in mind these high fluoride toothpaste should not be used for children under the age of 6 unless directed by a dentist. When it comes to toothpaste, there's something called an RDA value, which stands for relative dentin abrasivity. In simple terms, this value just represents how abrasive the toothpaste is. Toothpastes have abrasives in them to help remove surface stains which we get from things like coffee or red wine. Any toothpaste with an RDA value of less than 250 is considered safe to use. However, if you have tooth sensitivity, gum recession, or worn down teeth, I would recommend using a toothpaste with a low RDA value of below 70. The reason for this is because most of the tooth sensitivity that I see in patients is due to exposed dentin, and this is a result of either gum recession or worn down teeth. Dentin is the yellow colored tooth structure that is below the enamel, but it is also 4 times softer than enamel. Here is a picture of gum recession with damaged dentin root surfaces. And here's a picture of worn down teeth with exposed damaged dentin. If you brush this soft yellow dentin with a regular abrasive toothpaste over a long period of time, you could do considerable damage without even realizing it. Here's a list of low abrasive toothpaste, but I will also list them in the description below. A quick note, the high fluoride toothpastes mentioned previously are also considered low abrasive toothpastes. As a general rule, you want to avoid whitening toothpaste if you have any exposed dentin because they'll be more abrasive to get rid of those pesky surface stains. Okay, so this last category of toothpaste are for those that are at low risk of getting cavities, don't have tooth sensitivity, don't have any dentin exposed due to gum recession or worn down teeth. For these toothpastes, there's a lot of different varieties out there, and essentially you can just choose whichever suits you best. Just a quick note, I only recommend using toothpastes that have either fluoride in them, something like Recaldent or hydroxyapatite, which are scientifically proven to help remineralize your teeth. Also keep in mind, children under the age of 3 should only be using a rice grain amount of toothpaste, while anyone over the age of 3 should only be using a pea-sized amount. Regardless of which toothpaste you do choose, just make sure you're brushing twice a day for 2 minutes at a time using the proper technique. You can view the proper brushing technique in the video listed somewhere over here. If you found this video informative, then please make sure to like and subscribe for more future dental videos. Thanks!